Well, let's get on with it. Call to order the Board of Franklin County Commissioners meeting for Wednesday, December 16th.
Commissioner Stottlemyre?
Present.
Commissioner Howard?
Present.
Chair Waymeyer?
Present.
Commissioner Dickinson?
Present.
Commissioner Dunn?
Present.
All right. Y'all join me for the Pledge of Allegiance and remain standing for the invocation. I believe today's invocation will be led by Pastor Scott Dickinson.
Yes.
Hopefully I got his title right. So, all right. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, commissioners, and anybody listening. Why don't I just start out by sharing a verse I've been saying to people from the beginning of this pandemic thing that God is still in control. In Psalm 8, it says, "Lord, our Lord, how majestic is your name in all the earth." And then he goes on to say, "When I consider your heavens, the work of your fingers, the moon, the stars, which you have set in place, what is mankind?" That's us. That you're mindful of them, human beings, that you care for them. And then he finishes off the psalm with the same thought, "Lord, our Lord, how majestic is your name in all the earth." And I hope through all that we're going through that we remember that. Let's pray. Lord, I thank you for the places in which we live, the communities here in Franklin County. We've been aware in the last few days of just how good our people are. There's just been so many stories that I've heard of people reaching out and fulfilling the scripture where Jesus said, somebody asked Jesus, "When did we see you hungry and feed you? When did we see you needing clothes and clothe you? When did we see you in prison and visit you?" And he said, "If you did it unto the least of these, you've done it to me." And I have seen so many instances of that here lately, of people just reaching out to other folks in our community and helping take care of them. And that's a good thing. And so, Lord, help us to continue to do that during this whole year, but especially in this Christmas season. Let's make sure that children have gifts and that families have some hope. And those of us who are able to offer that, let us do that. Continue to pray for our commission and for the work that they do. I know it's been a little crazy doing it without being in all the same room, but Lord, continue to help them as they do their business. Continue to be with all of our community, our law enforcement, our EMS, and all the folks that are out there doing their thing to keep us safe. Watch over them. Continue to watch over each of our homes. Keep us safe, keep us well, help us to practice those things that keep us safe, wearing our masks, keeping our distance, all of those things. Lord, we just pray. I pray that as they start administering the vaccines, that we find that those are effective and that things are going well. Thank you, Lord, for this beautiful place that we have, even the cooler weather today. I just watch over our commissioners, gives them wisdom as they care about the business of the county. And thank you for each of them and for their lives and their families. I mean, we all just practice a very Merry Christmas this year. We ask it in your name. Amen.
Thank you, Scott. All right. Today we have a few things on correspondence and organizational business, the first of which is to receive an update from our health department regarding the KDADS grant. Who do we have on today?
Robert Walker.
Hey, go ahead.
All right. Good morning, commissioners.
Good morning.
I just want to take a couple minutes just to update you on a grant Franklin County received from the Kansas Department for Aging and Disability Services. And that grant targets underage drinking in Franklin County. And the health department is managing the grant of $32,000 for this year and up to 3 years additional. And our Franklin County Substance Use Prevention Coalition is guiding the effort, is implementing this grant. And just a little bit of data, according to the Kansas Communities That Care annual survey, in 2019, the percent of 6th through 12th grade students in Franklin County reporting any use of alcohol in the last 30 days was 19.43%. In 2020, it decreased to 14.56%. And the goal of this grant is to decrease use to decrease that 2% more to 12.56% by 2023. And just a little bit of information about the coalition. We currently have 15 members representing many of our community partners. We meet the second Thursday of each month via Zoom at 3:30. And the vision of the coalition is the elimination of substance use in Franklin County. And our mission is that reducing substance use is a priority in Franklin County through prevention, through the collaboration, and pursuing alternate resources. And our current grant is targeting underage drinking, and we have three components. One component is the prevention program. We purchased the Keeping It Real middle school and Real Media high school program from Real Prevention. And these are evidence-based programs that are being taught at USD 287, 288, and 289. And our goal is to include USD 290 in year 2 of the grant. And the format we purchased allows for in-person and virtual sessions, which has been beneficial during this COVID pandemic response. And the lessons covered, just give you an idea, the risk assessments, they cover decision-making, where to go for support, communication skills such as conflict resolution, drug refusal, and resistance strategies. The second component is a media campaign, and we have promotions going through the Ottawa Herald, print and digital. We have radio PSAs through COFO, and both of these are running October of 2020 through March of 2021. And each school has posters, large banners, bookmarks, banner stands that they have on display at their school. Any school is encouraged to place the PSAs and the digital information on their Facebook pages, as are the coalition members through their agency Facebook pages. And then the third component, the last component, will be a sticker shock campaign, which will be implemented in March of 2021. I met with the alcohol, beverage, and control officer to kind of start discussions, and we will recruit youth and we'll work with law enforcement to place stickers and bottle hangers with underage drinking messages at cooperating retail stores, and our coalition will soon begin recruiting retail liquor stores to participate in this campaign. And then finally, Greenbush is conducting the assessments of all these efforts. Each student is completing a pre and post test assessment, and the middle school program is a 10-session program. So it's being offered this fall semester. It will also be offered in the spring semester to different students. And then the high school program will be offered in the spring semester. And then we'll use the KCTC annual survey to kind of see where we're at in the 30-day alcohol use. And then part of this grant goes to cover a percent of my salary and benefits, and the remainder we're being used to purchase the programs, the media campaigns, and all that we need to implement this strategy. And I just wanted to take a couple minutes this morning. I appreciate this opportunity to share what we're doing with the grants. You may have people asking, because it is being offered in the preschool districts. You may have people asking about it, and just want to give you a brief update, and be happy to address any questions that you have.
I don't hear any questions. We appreciate the update, and we'll look forward to hearing your results when that survey comes back in.
All right. Thank you.
Thanks a lot for being on today. Our second correspondence and organizational update will be from Advent Health in Ottawa, and I believe Dallas CEO's on.
I am.
All right, go ahead, Dallas.
Commissioner Waymeyer, thank you for the time, and to the rest of the commissioners, some of which I know and some of them I haven't met yet. We just thank you for carving out a little bit of time for us to introduce ourselves to those of you we don't know, but also just give a little bit of an update as to what's happening at the hospital, and also a little bit of an update on the tax dollars as well. So for those of you who I haven't met, I am a Kansas native. I'm from Eureka, Kansas, which is about 40 minutes south of Emporia, and am so thrilled to have the opportunity to be back in a small community. My background is as an emergency department nurse. I did that for about a decade before getting into hospital leadership, and having the opportunity to come down here. So Harmat Bibi is also on the call here. She is our Chief Financial Officer, and she comes to us from Michigan, and has about a decade of strong financial background, financial experience from a hospital perspective. Both of us had worked at Advent Health Shawnee Mission previous to our time here, and enjoy a strong relationship there. So from a regional perspective, there's really nice synergy from our ability to work collaboratively across this area. But really pleased to be able to be a part of this community, and we consider it a privilege to be able to provide care here in Franklin County. I don't know that either of us would have drawn up COVID as the arrival time. I came in February and she came in March, and I'm not sure that's how you draw up starting off a period of time. But it's part of what our responsibility is here, and I'm proud of some of the things we've been able to do during this COVID period to help support the community. One thing that we're especially happy that we've been able to accomplish is implementation of what's called Advanced ICU Care, which gives us 24/7 access to an intensivist, something that a hospital this size would never be able to afford. And this program essentially can reach out to us and connect to us via telemedicine with cameras that see much better than the naked eye. And we have used that many times over the last 6 months. We're able to fast track that and get that live in June. And as we've cared for higher and higher acuity patients over this last period, it's served us very well. And I'm pleased that we've been able to keep people closer to home, especially during COVID. We know how difficult that's been on our community and just everybody around us. So it's something that I'm happy that we've been able to do. Also, just want to give a quick update from a hospital perspective. We hear across the news everywhere about the burden on our hospital, and our hospitals are failing, and we're at capacity and overextended. I can tell you right now in Franklin County, we're in a good position to continue to take great care of our community. The big thing that we heard in March and April and May was personal protective equipment and the lack thereof. And that was a real thing. Today, it is not an issue or a challenge for us here at our hospital. And so that will not be a limiting factor for us. The other thing that you hear now more frequently is staffing, and the strain it's put on all of our trained clinical staff. Some have left the workforce during this period of time due to retirements, and also due to caring for family at home, be it ill people or their kids are at home getting school at home and they had to step out of the workforce. So that's put a big strain on nursing and other skilled areas. We've been fortunate here at our hospital that we have not had any significant impact from a COVID perspective on our staff. We've had some get it from a community exposure perspective, but inside the hospital, we've been able to keep people very safe. And thus far, we keep our prayers active related to this, but thus far, we haven't had a huge impact from a staff perspective. You hear a lot about the vaccine, and we anticipate being able to get vaccines to our frontline, most critical staff related to COVID here in the coming days. And that will be a nice peace of mind for them to have that offered to them. So while we've been kind of slogging through this for 9 and 10 months, we have hope as we enter into 2021 that we'll begin to turn the corner on this, not only as a hospital, but really more importantly as a community, and be able to begin to move forward into a more normal life. So I'm going to pivot and just ask Harmat to share just a little bit of an update related to kind of what our volume picture has looked like over the last 10 months, to give you an idea of that perspective, as well as a little bit of an update on our tax dollars. Harmat, Harmat, we can't hear you.
Dallas, I can circle back to you, or do you want to try and wing it?
You know what? I may have her just move down here to my office. We're not very far apart, so I'll just have her pop over here. Hold tight.
Okay.
Just 1 second.
All righty.
All right. Sorry, this is the challenges of technology, but I'll just have Harmat slide in here and give her update.
Sounds good.
Good morning. Sorry about that. I had it unmuted and apparently you couldn't hear me. So thank you for the opportunity to meet with you all this morning. We're glad to be here. I'm glad to be a part of the Advent Health Ottawa team. And as Dallas shared, it's been quite the year to be a part of healthcare, but we're so glad to be here even with the challenges. So I had some slides I was going to share with you, but since my computer's having some issues, I won't be able to pull those up. But just wanted to give you a little bit of update on our volumes. So prior to COVID in January and February, we had a pretty strong start to the year. Our admissions and our ED visits were actually above prior year. And we were very, very happy with where volumes were trending. And then of course, COVID hit. So in March, we began canceling our elective procedures due to the uncertainties around COVID and the PPE shortages that we're experiencing across the country. And so that significantly impacted us. In addition to canceling our elective procedures, our ED also slowed down to about 50% of our prior volumes, just with a lot of fear in the community in terms of seeking healthcare. We're glad to say that as June hit us, we started recovering in our volumes, and most of our volumes recovered. Specifically, our surgeries were doing much better, but there's two main areas where we still continue to lag behind, one of those being our emergency room. We're running pretty far behind where we were running in prior years, and this is not unique to Ottawa. This is across the nation. Folks are just a little bit leery about returning to the emergency room. And we hope that we can change that mindset and let folks know that this is probably one of the safest places where you can be is within our hospital. And the second is our physician offices, our clinics. We're running about 35% behind where we were running previously in our clinics. And again, just a lot of fear with keeping some of those appointments. We have a lot higher no-shows and cancellations than we would typically have in those areas. So we hope that as you know, we all get more comfortable with getting used to the new normal with this pandemic, and of course with the vaccines rolling out shortly, that folks will return to healthcare and continue to seek our services. As it relates to transition dollars, or I'm sorry, sales tax dollars, we COVID also threw that off as well, but I'm happy to share with you that as it relates to the 2020 dollars that were previously approved, there's a number of projects that we were able to complete this year. One of those being the MAB building, which you're familiar with, which sits across the street from the hospital. This had significant damage that was discovered late last year. And despite some delays with COVID and sourcing materials for that building, we are very close to completing that and reopening that within the next month or so. This building is a building that we're very proud of. It's going to look great once we reopen it, and we're glad that we have another outlet that we can continue to serve this community. As Dallas also shared with you about our AICU project, we did use capital dollars to fund that project, which the timing of that could not have been better given the pandemic. And lastly, we are in the process right now of purchasing a state-of-the-art surgical microscope to help enhance our ophthalmology service line. This is much needed technology that we've been working on obtaining this year. So we're glad to finally be on our way with that. We're also working on solidifying our plan for next year's dollars, and we should have that budget finalized very soon. Lastly, we continue to use these dollars for charity care within our community. Our largest portion of our charity care is for emergency room, where we see a lot of our uninsured patients come through, and we're glad that we're able to continue to see those patients. So in closing, just want to say thank you. We're very glad to be here and to serve this community and this county through this hospital. And we're so proud of the work that has been accomplished here. As you probably know, we are a 5-star CMS rated facility. And so we provide excellent care, and we're glad that a lot of the work was set up ahead of us in order to provide this care. And we look forward to continuing to grow in this community.
Right. Do we have any questions for the Advent group?
This is Commissioner Dickinson. I don't have a question, but I do have a comment. I think it was very lucky for us that when COVID hit, that we were partnered with such a strong system that we had access to things that we probably wouldn't have had access to as a small rural hospital. So we're glad you are in our community, and we look forward to meeting all of you after COVID, hopefully.
So we've heard kind of a recap of some of the things that the local sales tax dollars have been used for this past year. I know you said Charitable Care is one of those. I guess, could you maybe double back and tell us some of your future plans for those dollars? Of course, I know those go before that board, which approves the use, but I'd assume you probably have an idea of where you'd like to see them go.
Yeah, Commissioner Waymire, I would tell you that we're still working. I wouldn't want to put the cart before the horse on that. I would tell you that charity care will be a significant component of that. We're also looking at, so as we referenced, a COVID year, and you're always looking from a business and growth perspective of how you continue to add additional services. In a year when you heard some of the volume hits that we've taken and absorbed, it's a more challenging experience to walk through where we're going. But we are working through our strategic planning process right now, and we'll have a better roadmap as we enter 2021 as to where we want to go as an organization. I know coming here, it's been 18 months, about 18 months since Advent Health's been here, and our goal is to bring as many services to the community as we can, as makes sense for a hospital of this size and scale. And so from a new programming perspective, we're evaluating and have some things that are potentially on the horizon that I can't quite unveil just yet, but would like to add additional services to the community. That will take some capital to make some of those things happen, and I don't want to commit verbally on something like that until we have it fully baked. But would like to roll into 2021 and be able to expand wherever possible, if that makes sense. So following that, so that January meeting with the Ransom Memorial Board, I think we would have a better picture of what we could present, and we could come back to the commission to share those at that time.
All right, let's talk a little more about charitable care then. So I guess what does that entail? Is that contractual write-offs, bad debt? Do you implement any kind of sliding fee scale?
Here, I'll slide my mod in here.
Yes, absolutely. So all of this is in accordance with our charity care policy. So when we have a patient that comes in that is uninsured, there's a number of steps that they can complete to qualify for our charity care. And so that includes both charity contractual write-offs as well as bad debt for those patients.
Okay. All right. Any other questions from any of the commissioners?
This is Commissioner Dunn. Just wanted to thank Ed and Al Dallas and the other updates. I haven't heard how the financial burden of COVID-19 affects individuals that have to be hospitalized and the hospitals themselves. Is there some sort of subsidy or something like that from the federal government to take care of these people?
So we have been recipients of some CARES Act dollars, which has very specific stipulations on what it can and cannot be used for. And so we're working through with our corporate team to figure out how we can substantiate those dollars. But there are some dollars that we have available to us through that method. And so that was through the HHS, and probably most hospitals across the nation received some dollars for that. Medicare also had some dollars that they gave us to take care of COVID patients as well, which was specific to Medicare patients.
Okay, I just wondered what the impact to the individual does that has to go to the hospital and get an ICU for an extended period of time. That sounds like quite a financial burden on any individual.
Right. So in terms of those CARES Act dollars that I referenced, there are specific stipulations in there that in order for us to be able to substantiate those dollars, we would not balance bill certain patients for COVID testing and for certain COVID care. So that does help ease that burden for those patients.
Okay, thanks.
You bet.
All right. Anyone else before we look to transition? All right. Well, thank you both for being on here today.
Thank you.
Thank you so much for your time.
All right. We look forward to hearing from you soon, maybe after the first of the year when you have a plan for 2021.
Yeah, I would expect that maybe in February. I think that's late January for that board meeting. So yes.
Great. Well, thank you.
Thank you so much.
All right. Do we have any public comment, Janet?
No, sir.
All right. Our consent agenda today, I did end up receiving that, would include claim vouchers from the 14th of this month in the amount of $1,877,418.54. We have special claim vouchers. Those are related to COVID and the CARES Act. Those are in the amount of $825,932.06, and tax change orders that we have are negative $1,441.24, as well as minutes from our, where's that? December 9th meeting. That is the consent agenda. Would anyone like to make a motion to approve?
It's Don.
Done. Second.
All right. Perfect.
Commissioner Stottlemyre, how do you vote?
Yes.
Commissioner Howard?
Yes.
Commissioner Dickinson?
Yes.
Commissioner Dunn?
Yes.
Chair Waymire?
Yes. All right. Our sole item of business today is to consider holding a public hearing on the 30th of this month where we would consider vacating a portion of Tennessee Road, north of John Brown Road. And David Lee, our Public Works Director, is on.
Good morning, Commissioners. A while back, I was approached by the landowners out there adjacent to Tennessee Road. They kind of tell the same story that most folks that own property along minimum maintenance roads tell, in that when it's wet, they get unwanted folks out there mudding and doing those sorts of things on those roads, which makes it difficult for them to access when they need to get into their fields and such. And so they have, all of the adjoining landowners have signed a short petition asking that road, that 1 mile stretch be vacated so that they can, I presume, gate it off so that would limit access to that road to only the folks that are adjacent to that road. So what we need to do, if you are willing, is to schedule a public hearing for at least 2 weeks away. I know December 30th, if we have a meeting, that would be perfect. If it needs to wait until early January, that would be suitable as well. So I'd be happy to try to answer any other questions that you may have.
Okay, well, if no one's opposed to taking a look at this item on the 30th, a motion in the affirmative would be to hold a public hearing on December 30th, 2020 to consider vacating Tennessee Road from the north right-of-way of John Brown Road to the south right-of-way of Hamilton Road. Anyone care to make that motion?
It's Don.
Commissioner,
I'll make it.
Commissioner Dickinson, I'll second it.
Commissioner Howard, how do you vote?
Yes.
Commissioner Dickinson?
Yes.
Commissioner Dunn?
Yes.
Commissioner Stottlemyre?
Yes.
Chair Waymeyer?
Yes. All right, now to staff reports. Derek.
Thanks, Colt. This is Derek. Before I jump into our COVID update, just a couple of quick things. The remodel and the annex is coming along incredibly well. If you haven't been over there to look at it, you might do that. The Lloyd Builders has just done an exceptional job. They've stayed on schedule, and we're pretty happy with where that's at. And so I think the space is going to be terrific. So I would encourage you to go over there and take a walk through if you get an opportunity. While we have them here, we are going to have them do a small amount of work in the commission chambers. Casey here a couple months ago ordered, I don't really know what to call it. It's basically an acrylic sign, but it has our new logo on it, and it looks great. And we're going to put it up in the commission chambers in place of what is currently there that kind of hangs on the wall right behind where all of you sit. The problem we found, though, we actually went in and put it up, but the sign is clear, and if you can envision that wall, there are seams in it. And there was really no way to get it remotely centered without having one of those seams go right through it. So we are going to have Lloyd Builders skim coat that wall and just have it repainted and probably painted a color that more closely matches kind of the color palette that we're using. But I think once that's done and we get that sign up there, I think it'll look great. And so that will obviously be done. We're hoping to have it done between this week and next, but by the time we're meeting in person again, I think it'll look pretty sharp. So in terms of our COVID response, I've got Nick on the phone so he can give you an update on numbers. We are currently continuing to work on our vaccination plan. Alan Radcliffe and Tom Winter have done a great job working with Nick and his staff on trying to get this put together. One of the challenges we're facing at the moment involves once we have enough of these to start administering to the community, finding a location where we can do that has become somewhat challenging. We, as you all know, we currently do testing in the annex lot. We can't really do vaccinations there, at least as it's currently set up, because one of the things we have to do is once we administer them, we have to monitor for 15 minutes. And given how crowded the annex lot is, there's no really good way to do that. Particularly when you consider that it would lead to traffic backing up probably out into 15th Street or just completely gumming up the annex lot. And so we've looked at other locations. We've looked at the fairgrounds. In fact, I've even been in contact with the fair board, and they graciously agreed to work with us, but I don't know that that's actually going to work. There are issues. We would really like hard surface for stair. You know, the dust can present problems for us in terms of we have to keep everything sterile. And so I don't know whether or not that's going to work or not, but we are kicking around the pros and cons of several locations. And once we kind of have a firm recommendation of what that looks like, then we will be in touch with all of you on that. In terms of the county's plan for its own people, we have a phased approach in place, and it kind of mirrors what the plan is going to be for the community. Several phases, the first being healthcare personnel who are either likely to be exposed or treat people who have COVID. And so when you think here within the organization, that would obviously be our ambulance employees and our health department employees. And so when we do get these doses, those will likely be the first group of employees that get them. And then generally the plan for the community, once you get those individuals taken care of, you start looking at people who are at increased risk for illness from COVID, people over 65 years of age, other essential workers, long-term care residents. And then from there, you kind of get down and you start getting into your vaccinating your general population. And so that's a very, very broad overview, but that's generally what we're looking at there. And I'm sure all of you received this, but we sent out a survey to our employees to see just what their thoughts were in terms of their willingness to take the vaccine, because we need that for planning purposes. And we've got decent response to that. About 60% of our people have responded. Of that 60%, over half have said that they will take the vaccine. And so that gives us generally an idea of what we're looking at. And then the remainder is pretty much split evenly among those who still aren't sure and then those who are just unwilling to take it. For those folks, we have asked, what generally are your concerns? And the most common response we're getting is just the unknown side effects. I think that's something that's gotten people a little bit worried, and as well as, what is perceived as an expedited time frame in terms of getting this developed. And my hope is that some of those folks, we can probably just with an education campaign maybe help change their mind. I mean, for example, you look at the time frame, and certainly this is the fastest vaccine that has ever been developed and brought to market. I don't think that's can remotely be disputed, but there has also been far more funding and far more manpower went into developing this as well. So it stands to reason that it would make it to the general population faster because of all the resources that have went into it. Still pass the same rigorous testing processes through the FDA, and multiple countries have put this through their own various testing processes, and the data that we're getting from that is generally really good. And so I've said it for a couple weeks straight now. That's part of what we're going to try and do here at the county is try and get some of this educational material out in advance of when we have this so that maybe our folks will feel a little more comfortable with that. So before I turn this over to Nick, do any of you have any questions for me about anything, frankly?
Derek, this is Don.
Yes, sir.
I'm just curious, what are we going to do with the medallion that is set behind us? That was, my memory serves me right, that was the 150-year anniversary of the county gift from the city of Ottawa. Are we still going to leave it hanging in the room?
You know what? I think we could do nearly anything with that medallion. And so if there is a desire to leave it hanging in the room, we can absolutely do that. And frankly, if the 5 of you don't want it moved at all, we can absolutely do that. We didn't, certainly weren't trying to cause any heartburn. We're just trying to obviously update with pursuant to our kind of our branding guidelines. But I'm all ears, Don, if there is a place that you would like for that to be.
No, I had no problem with Casey in the update because we did update. But I would like to see it stay in the room somewhere, maybe over there above where the county commissioner's pictures are on that wall. Just something visible to the public.
Okay. Yeah, I think that's a great idea. Or do the other 4 of you, would you have any issues with us putting it over in that location?
Commissioner Dunn, I think Don's right. I think we need it in the room somewhere. And that sounds like a pretty good place to move it over there by the pictures of the commissioners.
This is Commissioner Dickinson. I think that's a good idea, but as we're talking about commissioner pictures, I think we need a new one.
Yeah, no, we absolutely do.
And also, just to change the subject, have you considered the visitor center parking lot for your COVID testing since we're not using that right now?
Yeah, that's one of the locations that's being kicked around, and frankly, it's one that may end up winning out because there is a lot of there's a lot of things to like about this location. So yeah, we've talked about this location. We've talked about Crestview as well. There's some downfalls to that location. I mean, there's pros and cons to any location, but absolutely we've thought about this, and that may very well end up being the recommendation.
All right, excellent. Well, let's move on to Nick then.
Good morning, commissioners. I have a pretty lengthy report this morning. I'll try to get through it and not miss anything. We'll jump in first with testing. We have switched our testing practices. The state has us the opportunity to use MOD for to process our tests. By doing that, it took away from the restrictions we had with the state that you had to have symptoms or a contact. So we opened up drive-through testing on Saturday last week. We tested 44. I think it went very well. We're doing testing by appointment throughout the week, and we will open back up from 9 to 1 again this coming Saturday. So that has been a nice process. The nice part also is that we get their email and phone number, and they get the results themselves. So it has eliminated us having to call some of our negatives and has allowed us to really focus on getting our positives called. So that's been a good process, and I really hope it keeps going for a while. We'll see what happens at the end of December. We have our phone calls with the ESF and the nursing facilities. Every Tuesday, the ESF call, we discussed the vaccines, and I believe Dallas addressed it also. They should be getting their first shipment of the vaccine today or tomorrow. And we scheduled to get our first shipment of the vaccine the 22nd and 23rd. We purchased a new freezer with some of the COVID we had to prepare for this, and we chose right because the vaccine we're getting will work with the freezer we have, and so we do have a storage mechanism for that when it gets here. The priorities for our vaccine will be for health department and EMS workers, and then our second round will be for our high-risk individuals. And we're in the process right now. I hope to have it completed and rolled out by the end of the week, a pre-registry phone line for our high-risk individuals. So if we get that out there, people can call in and we can get them pre-registered for the vaccine. So when we do get it, we can call and get them in here. That should be out within the next couple days and allowing people to call in and pre-register for the vaccine. On our nursing home call, all of our nursing facilities, except for one, opted into Walgreens and CVS distribution of the vaccine, and that included Cedar Square and Sunflower Plaza. So all of our Ottawa locations are in on that, and as I said, all but one have opted on the Walgreens and CVS. We have one that opted on a local pharmacy, but the state's working with them to alter that, I believe. With the vaccine coming available, I think we're going to get really busy on answering questions and preparing for that. And as Derek said, we're working with locations and make sure we have staffing to accommodate getting the vaccines out as needed. We do have, my last look, we've had 1,388 total cases reported to the state, 17 deaths and 155 active cases as of last night. We haven't seen a monster surge, but we've also seen a lot of people, since they're going into the end of the school and the Christmas break, opting to quarantine versus getting tested. So we're still highly encouraging testing. We're working with the schools because we have a surge of basketball players that were testing positive, and we knew that was going to happen because there's no way to distance or mask up playing basketball or wrestling. So we're working with the schools to make sure that we're meeting the needs that they have and how we're going to deal with that. I believe that wraps up my report for the health department. I do want to discuss really quick that dispatch, as I've talked about it, but we are working more towards this. We should be receiving 5 devices from Deploy and AT&T test the statewide CAD and dispatch system. With this, it'll allow us to look to see if this is a system that could work for us in the future for computer-aided dispatch and the mobile unit. So I'm hopeful that we can get a good trial out of this. We're already paying the CAD systems through the state contract that we have. So this could be a good option for us to move into the future with the CAD system as we roll on with that. So we've got a lot of exciting things going on in dispatch, and we're busy in the health department. One thing we did find is Derek pushed out monitoring for 15 minutes after the vaccine. We need to have EpiPens and the stuff in case somebody would have an anaphylactic reaction, we will be utilizing EMS personnel to stand by and do the monitoring aspects of the vaccine. So this will be a big effort in EMS, law enforcement for probably traffic control, emergency management, and the health department when we start these vaccine clinics. So it's going to be a large endeavor that I'm sure we're very ready for. We're planning every day. So if you have questions, I'd be happy to answer them. If not, thank you.
This is Commissioner Dunn. Nick, I know some outfits just come out with a rapid antigen over-the-counter test for COVID, and it looks like it could be very detrimental in the statistics if somebody actually tested positive with these over-the-counter deals and not even report them. So what's your thought about that?
I'm glad you asked that because it prompted me to discuss another test that we have coming to the community here pretty quick. So the problem that we see is there's so many locations and now home testing where people can test for COVID that aren't reported to the state. I have rapid testing places in the city that haven't reported to the state in a month, and I know they're testing positive individuals. That is probably one of the biggest hurdles. The other thing that we see with antigen testing, and my confidence in it is not good, just because they're not symptomatic or testing at the right time. Those produce so many false positives and negatives, and that's what we've been trying to do throughout this whole process is false positives and negatives. So I think that there's an opportunity for people to know if they have COVID, but if they don't follow the directions, they don't test at the right time, I think it's going to create a lot of false hope or false assurance that they may not have it, even though they could have tested too early. So it's just another one of the things you have to battle through. But with that, we do have a outfit coming in to test in Pomona starting, I believe, Friday. They're going to test through the rest of the year at Pomona. We've been on multiple phone calls with them, and this falls back into the same thing with these rapids. One of the questions that I had on the phone call with the state and them is how they're going to report that to the local health departments. And they told us we would find it through EpiTrax. And if you remember me talking, EpiTrax has been delayed throughout the whole process. And if that's the state's way of notifying us the positives they find in our community and surrounding communities, then we could be delayed on this. So it could be a catch-22. We get people tested, but we may not get them traced for 3 or 4 days after the test. So we're working with them to see if we can get printouts of who they test and what that looks like. So it's a never-ending process to stay above it.
So Nick,
one last question. This is Roy again. Just to follow up, person gets vaccinated, is there going to be some sort of certification? They got both shots and they'll have something they can carry with them if they want to travel or something like that.
That's another good question. With the vaccine, there's supposed to be a card that's given out for the vaccine, telling them to come get the other vaccine. And we know that's got to be within 20 days of the first one. We will have a way of tracking it. They will have a card that shows the vaccine they got, the lot number they got it from, given to them at the times of the vaccines. Where we're running into the concerns when we start doing mass vaccines is with it being a 2-part vaccine. If somebody would say go to the local provider, which right now we don't have any local providers that are in to give the vaccine, they're applying now. But if they would go to their local provider for their first shot, it would be virtually impossible for them to come to us for their second just because of tracking. So we're going to have to work through that. We do have the systems in place to track those individuals in-house and send them reminders from the health department. But if somebody gets a shot at one location, it's going to be virtually impossible for them to go to another one to get it. But I do know there will be cards given out with the lot number and the vaccine so people can show and have identification of what vaccine they received.
Thank you, Nick.
This is Commissioner Dickinson. I have a couple of questions. The first one, somebody had asked me yesterday, when you do get a vaccine, or the vaccine, do you have any idea how long it takes before you are supposedly covered? And then the second part of my question is, I mean, I know people that are notorious about having bad reactions to shots. So if they had a bad reaction to the first shot and they choose to not take the second shot, would they have any coverage at all?
Those are another group of questions that we've asked. We're trying to figure out, and honestly, I don't have strong answers for those. I can strive to have you answers for that next week, but we're learning more and more about the vaccine. Honestly, the vaccine that the health department's getting is being reviewed by the FDA as we speak. We know the Pfizer vaccine has been approved as the one that the hospital's receiving, and we know that they have a grace period of 17 to 22 days to get the second shot. We know more about it than we know about the shot that we're going to get. So as that information comes in, I will be happy to share it, but at this time, I really don't on the limb and take a guess.
Yeah, Nick, and this is Derek. I'm going to jump in there. It's not that Nick Robbins or the Franklin County Health Department doesn't have answer to these questions. I mean, you're just asking questions, both you, Ian, and you, Roy. They're great questions. I'm glad you're asking them, but that info isn't really available generally at this point. And I think that also kind of leads to some people having reservations about this, is that there are a lot of great questions that we still don't know. I mean, I will tell you, Ian, in terms of the multiple shots, everything that I have read and am hearing would indicate that you need both of them, and that if you just get the one, not to plan on, it might not be completely ineffective, but basically that you need both to ensure that you are actually vaccinated. And so, but yeah, we will provide updates to the board, obviously, on a weekly basis as we get more info. I just want to make sure that the commissioners understand that, it's not that our health department is just lacking this information. It's just generally, it's not out there yet. So thank you.
Not sure who wants to answer, but so the state sets priority on who receives vaccinations first?
Yes, the state has put out a three-phase approach to the vaccine and how that's going to be distributed. And the first, as Derek mentioned earlier, is going to be healthcare providers, and then there's a phase 1A and a phase 1B. The phase 1A is going to be healthcare workers, and phase 1B will be the individuals that have underlying medical conditions, cancer, kidney problems, COPD, heart issues, people over 65 years of age, and other essential workers, along with long-term care residents. That's all going to be the phase 1. And the state's really not giving us an idea when phase 2 will be sent out. We know that if everything passes what we're planning on it passing the FDA, we should have our first round about the 22nd or 23rd of this month. So, and start vaccinating our healthcare workers at that time.
So, healthcare worker or even a frontline emergency worker, that's pretty straightforward. I heard you talk about high-risk pre-registration. I assume there's some kind of a matrix or that we'd go by. I mean, to deem what is a high risk. I mean, obviously, age is a factor, but so a younger person who may have compromised immune system or receive cancer treatment, something like that, would put them up there.
Sorry.
No, I say, is that part of the pre-registration process? Is there like a matrix or something we go by that the state's put out?
The only thing we have right now is what I was kind of reading off to you is the people with cancer, chronic kidney diseases, COPD, heart conditions, sickle cell, diabetes are the main ones that they're telling us meet the severe risk of illness. And then the next bullet point is anybody over the age of 65. So with the pre-registration, we will utilize those. We will ask them what their underlying health problems are, and we'll screen via that way when we start looking at how many vaccines we're going to get in our second round.
All right. And I mean, these are somebody else's decision, or these, a lot of this is coming from state or federal. So if you don't know, I don't begrudge you. But we talk about local providers, being registered, so places like pharmacies, and are they going to follow that same guideline? And I guess will we be able to coordinate? So if you don't qualify as somebody with underlying, if you don't get the answer you want here, would you go somewhere else until you do, or would they not be brought into the mix until like the second phase when more vaccines are available? Do you know any of that?
I know that they just opened up for healthcare providers like OFP to register to administer the vaccine. What I understand is they will be held to the same guidelines as the health department and the hospital, and also the pharmacies. The pharmacies' primary response in this at this time will be for long-term care residents, or, as I said, your senior living facilities or high-risk living facilities such like COF, Sunflower Plaza, Square, Washburn, the places where there are high-risk individuals. That's where Walgreens and CVS are targeting their efforts. And then I assume that when the doctor's offices do get the opportunity to distribute this, that we're going to be closer to phase 2, and that's where we're starting to open it up more to the general populations and pick 1B phase people that have not gotten the
Thank you, Nick.
This is Commissioner Howard.
Go ahead, Rick.
I got one quick question for you. Comments you made that the vaccine that we will get, the freezer that we purchase will work for it. So it sounds to me like there's not a chance that we will be getting the Pfizer vaccine, right?
At this point, we are told that the Pfizer vaccine is going to the hospitals. We are not going to be getting any Pfizer. We'll be getting the Maduro, I believe is what it is, vaccine.
Okay.
Which is good because, like I said, that vaccine doesn't have to be stored at the negative 80 degrees Celsius like Pfizer does.
All right. Well, any other questions for Nick?
Yeah, Colt, this is Derek. I want to, if you'll indulge me, respond to your comments because I think you did a great job of asking questions that illustrate the logistical issues that not only we're going to have, but just every community is going to have. Like, as of right now, all we've really received from the state is basically a spreadsheet that just lists a handful of underlying health conditions that the state is saying puts someone at increased risk for severe illness from COVID. We haven't gotten any kind of quote unquote matrix. We don't have any kind of enhanced screening criteria. We literally have just a list with a handful of conditions. And to answer your question succinctly, I mean, no, there isn't currently any way for us to if somebody comes to us and, early on and says, hey, I'm at increased risk, and for whatever reason, we don't feel like they have any kind of documentation of that, there's nothing keeping them from going someplace else and trying to get a different answer. And so that's just one of the many things we're going to have to try and work through. The good news is, eventually, once we get enough of these doses, it's not going to be as much of an issue. But in the very beginning of this, it absolutely will be. And how do we determine whether or not somebody's at increased risk, or are they just trying to move their way to the front of the line? Those are very real issues that we haven't gotten any kind of guidance on yet. And so we are anxiously awaiting that, and hopefully we have it, because, this first dose that we're likely to get next week, I suspect that, we have enough healthcare personnel that we'll probably get through all of that. And hopefully it's enough to cover all of them, but I don't anticipate having enough surplus for there to be much of an issue in terms of that phase 1B crowd. But eventually we'll get there, and I know we like more guidance. So I appreciate your questions, but no, those are issues that we're still waiting for more information on. Thank you.
Thanks, Derek. Anyone else? All right, well, thanks, Nick. Sorry we asked you a bunch of questions about someone else's decision, but we appreciate the information. So, let's go down to David Lee, Public Works Department.
Good morning, Commissioners. Since last week, our road and bridge crews spent a couple of days hauling cover material out to the C&D landfill, which we have to do on a regular basis. We also worked in conjunction with the city of Pomona to clean a ditch along Colorado within the city limits. We've added material to a couple of bridges, one abutment on Reno Road just west of Florida, added material around a low water crossing on Thomas west of Arkansas. We've also installed a couple of entrances, repaired a couple of entrances, and repaired fence in the sheriff's impound lot. Today and tomorrow, well, maybe even through the end of the week, we'll be back down on Idaho, south of Cloud, assisting with some tree removal along the right-of-way. To update you on the asphalt patching job, I spoke with Kilo yesterday. They are planning to continue working Thursday and Friday this week, with the focus being on Sand Creek and Colorado, and hopefully they get into Greenwood Estates. However, the temperatures aren't very conducive to overlay work, so we more than likely are going to be postponing the approach at Labette and Eisenhower, along with the overlay work on Labette and Montana by the new I-35 bridge. We'll more than likely push that into next year when they open up the asphalt plant. They had planned to close the plant already, but they are seeing a couple of good days coming up, so they're going to keep it open for us to get a little further along in the project. And then finally, the landfill expansion report and the pavement management system report will be presented by our consultants sometime in January. I would expect mid to late January for those to show up on your agenda, where we will walk through in detail both of those reports. And that's all I have for today.
Questions for David? Thank you, David.
Thank you.
Janet?
The only thing I have, Commissioners, is just a reminder that next week will be your budget amendment will be on the agenda for next week. That's it.
All right. Commissioners' comments, board reports. Commissioner Dickinson.
This is Commissioner Dickinson. I attended the Chamber Coffee last Friday at ORC to introduce the new Executive Director, Levi Meyer. He's been a part of the community for several years. His wife teaches at Sunflower Elementary. And you know, he comes in again in a COVID year and in the middle of a lot of unique situations where you're trying to provide opportunities and still meet COVID requirements. So anyway, it'll be great to see him be able to do his job when he'll be able to do everything that he would like to do. During that meeting, somebody had made a mention of a raffle that they were having to raise money for the fireworks. And so last Friday I purchased a ticket because I thought, you know, I can anyway. Last Friday evening, I was lucky to be drawn as the winner of the $500 Price Chopper certificate. So that was kind of exciting. One of the things I wanted to share was about the sheriff's department. I was kind of hoping that the sheriff was going to be on today. I don't know if you all had heard about it, but they had posted on their website, on their Facebook, that they had several calls for service about a person walking along 59 highway, and when they went to the call for service anyway, it turned out it was a lady who lives in Princeton but works at Love's, and she did not have a vehicle, so she would walk to work and then she would walk home. And after they had picked her up to take her to work several days, they kind of sat down and brainstormed on how they could possibly help her. And between some of the officers and reaching out to some community partners and using their No Shave November funds, they were able to purchase not only a van, but a couple of new car seats for her kiddos and a Price Chopper gift certificate, and just be able to make somebody's day much brighter. And so I just give our kudos to our sheriff's department, the way that they reached out to this family. We're excited about the good news of the vaccine, but we still need to be very vigilant. Christmas is coming up. You know, we don't want to let our guards down now. So I heard this morning that at this point, 1 person a minute in the United States is passing away from COVID. So even though there's light at the end of the tunnel, we still need to be very vigilant in the way we are approaching it. And that's it for me. Thank you.
All right. Dawn?
Yeah, we did have a teleconference, the Solid Waste Authority, the other day. It's kind of been a frustrating deal with that and the RC&D board both. We haven't had a face-to-face meeting since last February. So it's kind of a difficult thing to keep moving forward, but we do have a new coordinator with the Solid Waste Authority, and she's been spending a lot of her time with training and education, better training and grants and so forth. And she is presented to us the other day a deal. We're pursuing a grant program that will help any small town in our 6 county areas that want to do a recycling program. And she'll physically write the grant for us, for them, for nothing, as a deal through the Solid Waste Authority. We'd have one other grant we're applying for, and I mentioned the other day, for a storage container for Franklin County to be used, and we're in the process of that and working with David Lee. She presented to us her ideas for promotions in fairs, schools, and her on-site visits have been a real problem with the COVID-19, but she's doing the best she can with that. We are getting ready to put together our yearly audit. Every year we pick a member from, one member from 3 different counties and alternate that every other year that way. Franklin County was involved in it last year, so it would be another 3 counties this year. We'll be meeting, and I don't know if that's going to be virtual. It may be virtual, and putting together our audit for the year. I'm on the Bernadine Basin Advisory Committee, and we'll be meeting Thursday, and we're still meeting by Zoom also, and we'll be going through that. And the other day, I know I brought up with Larry where we stood. I don't know if anybody else got this information or not, but Larry sent it to me after I requested numbers, and he got it right back to me the next day and let me know that for 2020, we've had 68 new residentials, 30 remodels, 66 accessory structures, and 10 commercial structures. And he said we also approved 30 new home final inspections and grant occupancy permits for new home building permits that previously were applied for in 18 and 19. So it sounds like our numbers are really doing good for everything that's going on. And I know I've seen a lot of new, and there are 3 or 4 more new homes just right in my local area down there. So that's a good thing to see. That's always a good sign. That's all I have right now.
All right. Thanks, Don. Rick?
I don't have anything.
All right. Roy?
I don't have anything at this time.
Nor do I. All right. Well, we'll look to adjourn unless anybody has anything. Speak up. All right.
I have a quick question for our organizational meeting. Will that be, are we going to do that Zoom?
This is Janet, and I have spoke with District Court, and they will be providing a judge, and we are planning to do it via Zoom. So we do have a judge that's going to be attending via Zoom for the meeting to swear everyone in, and we're planning on that being on the 11th of January.
All right. Was there a motion to adjourn?
Don, motion.
All right. Is there a second?
Roy, second. Roy, second.
All right. All in favor of adjourning, say aye.
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 All right. Any opposed? Thank you, everybody.